Year. This week, President Obama and congressional Democrats started their push to reform the health care system. But do Americans want a government-run health care option? Congressman Frank Pallone is a member of the Energy and Commerce Committee and chairman of the Health Subcommittee. He joins us now to talk this over. Congressman, thank you so much for joining us today.
Thank you, Shannon.
All right, it is a big plan. There seem to be some good goals behind it, but there are a lot of questions as well. How would this plan be funded?
Well, right now, the president has talked about major cuts in existing programs, whether that be reimbursement rates for certain services that are overutilized, like imaging, for example, or different things that are overutilized, as well as looking at certain Medicaid and Medicare cuts. There probably would have to be a new source of revenue, but it'll be a combination of the two.
All right. How do you feel about a government-run insurance plan? A lot of folks say if it's an option, it will undoubtedly be cheaper, and a lot of people may abandon their private health insurance. Is that how you see this playing out?
I don't really, because I think that for people that don't have insurance or who want to move to the new health market, it will offer both private plans as well as a public plan. And, of course, the public plan will be very similar, I would say, to Medicare. Most people who are over 65 like Medicare, and people will have a choice. I mean, the main thing here is people will have a choice. If they like their plan now, they can keep it. If they think they can get a more low-cost plan through the health marketplace, either private or public, they can choose that. I think that we'll have a mixture and we'll have a lot of competition within this health marketplace for those who opt to go there, and that'll bring costs down. But, the main thing, of course, is everybody will have insurance, too. So for a lot of people that have no insurance now, almost any option is better than what they have because they have nothing.
All right. There is obviously a lot of room for negotiation here on Capitol Hill because the two sides seem to be very, very far apart at this point. How do you see them coming together? Are they going to come together, or is this strictly going to be a numbers game where the Democrats have the numbers they need to pass this kind of plan?
No, I've talked to a lot of Republicans, and I think that many of them are amenable to it. What they're saying is that, as long as people can keep the insurance they have, and if they can choose between a public and a private insurance plan, through this health marketplace, and there's a level playing field so that, one doesn't favor the other, and there's a real choice, which I think there will be. Then they'll be fine with it. I really think that this builds on what we have now. I call it an American system because it's very unique in the sense that it builds on the system we have but offers options, both public and private, to people who don't have insurance or who think they can get a lower cost one through this, through this federal initiative. And I think it's really going to bring costs down, which, is very important because the health care costs are just climbing so dramatically that more and more people can't afford it, and more people become uninsured because they can't afford whatever options they have with the status quo.
All right. Congressman Frank Pallone, we thank you for your time today. We'll watch and see how it plays out here in Washington this summer. Thank you.
Thank you, Shannon.
Well, healthcare, the election in Iran, there's plenty to talk about with our own Britt Hume. His thoughts on the week's big news.